The root canal is a technique that we use to make this tooth stay the same. It will be the same tooth. It can even look the same after the root canal. Nothing can change. It's just about this tooth become completely insensitive. It's not painful. It does not feel the cold, the heat anymore. In every root, we have some kind of a canal that goes through the root and gives the blood irrigation that comes inside the tooth and the nerve. What we do is we clean these canals, we remove everything that's organic inside, they become empty canals, and then we fill them with a material to stabilize them the way they are. Sometimes people do need root canals even if they don't feel anything wrong. When the nerve dies inside, it's still inside, but the tooth is not sensitive anymore. But does not mean that we can keep dead tissue inside. And usually when we have dead nerve, it comes with an infection that spreads to the bone, because when it's not vital, so the infection can evolve without causing any pain. In that case, sometimes we discover on an X-ray that a tooth has a big infection, but the tooth is not giving any symptoms to the patient. When the nerve is dead, bacteria will attack it because it's dead, there's no defense inside. So it becomes infected, and the infection will become an infection of the bone. So what started as a small cavity in the tooth ends up an infection in the bone. That's why even if an infection is completely asymptomatic, it has to be treated for the general health, for the bone health, and to be able to keep the tooth itself. The first technological tool that will help us do the work in a better way is the digital X-ray. The digital X-ray allows us to have different angulations and see better the number of canals, the shape of the canals that we have in the tooth. Other than the digital X-ray, we have different tools. One of them would be a digital apex locator. This is a tool that would allow us to measure the depth of the canals and would allow us to see how deep the root goes inside the bone, to see exactly where to stop our preparation and our cleaning. The third tool would be the motorized technique. And the motorized technique will be using rotary instruments instead of the hand-driven instruments. So instead of working with our fingers, that would take few sessions in the past to make a normal root canal. Now we can do that without really taking a lot of time, because there are tools that are doing this in a rotary fashion. It's engine-driven. This will make the work faster and easier to do. Another advance is the technique of filling the canals. To be able to fill the canals, now we have different systems, what we call the System B or the obturation unit. We have the calamus unit and we have the thermafill. These are all different techniques that will allow us to fill the canals in a very short time and to do the job perfectly without the hassle of taking a lot of time and without using any sort of heat that could be dangerous to the patient. In the past, root canal would take 3-4 sessions, putting medication inside, sending the patient home, coming back in pain, then doing it again. Now the root canal is 30 to 40 minute procedure. So it's nothing to compare with the past. And I hear this every single day, that the patient comes and, no, I'm afraid of root canal. And then when we're done, he's off the chair and he say, oh, so that's a root canal. So what was I worried about? Because it's about, being afraid of the unknown or just other people's bad experiences. This is a very important problem for people. Like, I didn't sleep last night, emotionally I'm down, I don't feel good. So you come to me, I do the root canal, and then you leave happy. This makes me happy. This is a good part of my job.